our health department, and we can actually get that appointment for you. But then beyond that, all of it will be pretty seamless and high tech. And I'm very excited about everything that I heard about that testing paradigm. That's not the only testing paradigm that's being unrolled here in Fresno County. We have a lot of our hospital partners and a lot of our doctors and medical providers that really want to get going as being part of the solution for doing more testing for all of our county residents. So I will explain more about those developments as we firm up some of the plans that are happening all over the county. But I'm very optimistic that we will be able to get to our goal of testing about 1,500 people every day to make sure that we're identifying every single cluster and infection of the COVID across the county. You might have heard today that the governor made some announcements about the roadmap to recovery and really some of the ways in which we are looking ahead and seeing how we're doing. And we're very much in touch with our state partners as well as our local partners here to see how best we can kind of implement some of those processes here in Fresno County. So I'm glad that we're having that dialogue. I'm glad we're having that discussion. I think this is the time to be thinking about how can we go ahead and really look at how we're doing locally and thinking about what processes need to be in place to safely reopen some of the businesses, some of the sectors, and some of the activities that we've had to put on hiatus. And I think that that dialogue is coming along. I'm really happy to hear that the state is watching that very carefully, and that here locally we have a lot of interest in making sure that that gets done well. I'm going to have more to say about that as we have more planning done. I think that it's still premature to assign a specific date to know exactly when we can go ahead and reopen everything. I think it's going to happen in phases. And I think that we're going to very carefully see just what our case counts are doing at every single phase so that we can make sure that we do it very safely, that we do it in a way that protects the public's health and it protects all of the really hard work that we've already done in the healthcare sector and make sure that we don't lose ground as we start opening things up and doing things a little bit differently than what we have been doing. So I really want to commend the whole community. I think we've all come together in a way that's, you know, my whole time living in Fresno, I've never seen the community come together the way that we have in the last 4 weeks, in the last 4 to 6 weeks. So it's been really amazing. And I really just want to make sure that we stay safe as we start to think really and dialogue and really answer these hard questions about, you know, how can we get to a point where we really have, you know, the businesses back online, the schools and the summer activities and all these other community groups that really want to be more active, get back online. Those are all important questions. We really want to partner with all of these agencies and groups as we move forward. We've already committed to doing that with a lot of our stakeholders, and we dialogue with them just about every week, and we're going to continue those dialogues and really look at our local statistics and look at what's going on statewide as we make those decisions. I'm going to end with one announcement about Friday, and then I'm going to be very excited to introduce our speakers who I hope can speak about their projects. The announcement about Friday is that on Friday at 4 p.m., we're actually going to have a town hall. And I'll see if, is Brandy on? Brandy Keidel is our communications lead at UCSF Fresno. And I wonder.
Hi there, I'm here.
Oh, great, perfect. Brandy, do you want to talk about what you're planning for Friday so that we can give everybody a little bit of a preview?
Sure thing. Again, this is Brandy from UCSF Fresno. As Dr. Vora mentioned, we are working closely with the Department of Public Health, Michelle, Sim, Dr. Vora, and other community partners to offer a virtual town hall that will be taking place, I believe, on Facebook, and we'll have experts who can talk to. Dr. Bora can give an update again on the county numbers to the community. We'll have somebody there an expert to speak to the biology of the disease, signs and symptoms, community resources. So we really think this will be a wonderful opportunity for the community to hear a briefing that will be on COVID, and we'll be sharing more details about that in the near future.
Yeah, thank you so much, Brandy. When I was working my shift all day today, I was able to learn so much. And so much of medicine, especially academic medicine, is really just learning from our colleagues, from our patients, and really asking questions about how we can do the best that we can in order to get people better. And so I think that this town hall really allows us to showcase the amazing work that's being done at UCSF Fresno and Community Regional Medical Center, but also community-wide with all of our medical communities. So I'm definitely looking forward to that conversation. Thank you so much for helping to organize that. And I hope all of you on the call today can make it. And I hope that members of the public are able to join in as well and send us their questions and the things that they want to hear about. So that's going to be 4 o'clock on Friday. I'd like to go ahead and introduce our first speaker, and I think I'll go ahead and start with Ethan. Ethan Keidel is, Dr. Keidel is a professor and chair in the history department at Fresno State, California State University, Fresno. He has been writing some amazing columns and been doing some deep historical research about pandemics, and specifically about the Spanish influenza pandemic from over a century ago. And really, I'm really learning a lot about really the response to that pandemic, because I don't know of any other better resource than Dr. Keidel's writings about how Fresno and how the Central Valley was able to cope and get through that last medical crisis, which was the Spanish influenza pandemic. So I hope I represented your work. I'll let you take it away, Dr. Keidel, and just talk about what you've been up to.
Can you all hear me? Okay, great. Thank you. I appreciate the opportunity to tell you a little bit about what I've been doing. So this is a project, to be honest with you, this is a brand new project for me. It's something I started about a month ago, a little over a month ago, as we all sort of went into lockdown. I'm a historian, but I'm not a historian of medicine, certainly not an epidemiologist. And like most historians, I knew that the 1918-1919 influenza pandemic was a worldwide event, that it impacted millions of people, it killed millions of people. And I tend to process things as a historian through the past. I tend to process current events through the past. And so I started in mid-March, as soon as Fresno State classes shut down, I started digging into what happened here. I didn't know really what had happened here. And fortunately, we have digitized newspapers that allowed me to do this at home, not going to an archive like historians typically do. And I was able to find a whole bunch of stuff out, and I started writing what I call real-time dispatches that, and I post them regularly on a website that I think we can link to later. I call them dispatches from Fresno 1918-1919, following the Spanish flu pandemic in real time. And that's what I try to do, is to read newspapers, and every 3, 4, 5, now every week, I post a new dispatch. I have 6 up, and I plan to keep it going for the next several months. And the idea is that people can follow along as we live through our own health crisis, can follow along with what happened here 100 years ago. And there are a lot of striking parallels. There's certainly a lot of things that were different. I can take you through kind of a quick overview if you think that would be helpful. Okay. So just to provide a little bit of broader context for those who don't know this, the 1918-1919 pandemic was, that was an influenza pandemic. It was a particularly virulent strain of the flu that started, although it has the name Spanish flu, it's something of a misnomer. We think, most scientists think it started here in the United States, in the Plain States in Kansas, spread over, because World War I was going on, spread over via troops to the fronts in World War I, moved all around troops and various civilians in Europe, eventually made its way to Spain. Spain was a neutral country during World War I, unlike the United States, Germany, France, England. So it did not suppress media reports about it in the way that the warring nations did. And so it becomes known as the Spanish flu because there's lots of reporting on it there. But eventually it comes back to the United States in the fall, and that's where it really spreads across the country in its most virulent form and starts to impact cities like Fresno. Worldwide, it kills about 50 million people, kills 675,000 Americans. Here in Fresno, it killed in the winter of 1918, 1919, it kills 258 people. Which it may not seem like a lot unless you know that there are only 45,000 people living in Fresno, in the city of Fresno at the time. So, if you translated that to our population today, that would be something like 3,000 Fresno residents who would die in a matter of 5 months. So it was a pretty significant thing. But one of the biggest takeaways I would say that I've found is that overall Fresno did pretty well. Certainly compared to other cities at the time, the city was fairly quick to implement social distancing measures. Some similar to what we are implementing today, others a little bit different. Certainly compared to cities like Philadelphia, which was very slow and where you see extraordinary suffering and death, and where you see local officials basically downplaying the outbreak, looking the other way, allowing parades, massive parades, 200,000 person in attendance parade at one point to take place as people are dying in droves. That was a catastrophic thing that led to these high death tolls elsewhere. Fresno, compared to most California cities and most cities across the country, was fairly quick to implement some social distancing measures, some of these non-pharmaceutical interventions. I've learned that term in the last month. So it first makes the flu first appears here in Fresno in early October of 1918. By the middle of the month, the city has started to enact restrictions. They've shut down schools, they've shut down theaters and movie houses and churches, outlawed public gatherings. Then they start to implement more limited hours, some of them voluntarily done by business owners, others are required, more limited hours for other businesses, department stores and restaurants and saloons and soda fountains. They do mandate by the middle of October that every resident must wear a mask in public. Man, woman, or child, if you're outside of your house, you must be wearing a mask. Most of the masks at the time were gauze masks that probably weren't very effective. But you had to wear them, and there were stiff fines. An ordinance was passed at both the city and the county level that called for jail time, called for stiff fines, and the police rounded people up and threw them in jail. At one point in December, they threw more than 100 people in jail over a course of 3 days. So they were implementing lots of these measures and were making sure that people followed them. Most people seem to have early on, but that starts to change over time. They also implemented, as you were suggesting, a quarantine. They had to create a whole bunch of temporary hospitals. As you're in one, hopefully we won't have to use it today, Dr. Vora, but they, at the time, at least 4 temporary hospitals in addition to the county hospital were put into play, and all of them were filled up by the middle of October. There were, according to the counts I've done so far, 3,500 people caught the flu and were sick with the flu in October and November of 1918. So that's 10% of the city is sick. And that's just a count that the city health officer at the time thought was a low count. He thought that they couldn't get physicians to get all the accurate information he wanted. So upshot is October, November, this comes in, it hits very hard, hundreds of cases a day by the end of October. By the end of November, the first wave has crested. Things are getting a lot better. There are fewer and fewer cases. The hospital crunch dies down, and they open back up. They reopen schools, they reopen theaters, they cut down on the restrictions, they they take away they say they want people to continue to wear masks, but say we're not gonna penalize you for it. And almost as soon as that happens, the second wave hits, and that's in mid-December, and that second wave will last through early February, but it really is mostly mid-December to mid-January. In that second wave, one thing I've discovered is that there's a lot more pushback from the community about the restrictions. There were people in the first wave who were certainly violating the mask law. If there's that many people getting arrested, there's a lot of people who aren't following it. But in general, the authorities, at least in the newspaper, are talking about suggesting that most folks most business owners, most community members are going along. That starts to change in the second wave. You see a lot more resistance. Business owners refuse this. So the city health authorities do implement restrictions again towards the end of December. Some business owners refuse to follow them, refuse to shut down. Some threaten lawsuits against city officials. Eventually, this leads to a dispute between the city trustees, which were in charge of the city, and the city board of health. The city trustees are worried about these threatened lawsuits, aren't sure the measures are all necessary. They're getting pressured by business leaders. They're getting pressured by ministers in some cases, ministers who want to be open for Christmas and Christmas services. So it's a pretty nasty struggle. Ultimately, it leads the city health authorities to rescind the measures that they had tried to implement, say, okay, all bets are off, and then they resign. The entire city board of health resigns in protest. And for about better part of 2 weeks, there are no mandatory restrictions in the city. In that period, dozens of people do die. More than 1,000 get sick. Eventually, the mayor helps broker a resolution. Fortunately, by the time that happens, the flu, the worst of this second wave, which wasn't as bad as the first, the second wave has mostly broken, and they don't have to pay nearly as bad consequences for that fight as they would have had it been as severe as the first wave. So that's kind of the overarching story that I pieced together so far.
Thank you. That's riveting. Oh my gosh, I could listen to that for hours.
You're not like my family.
When you talk about just some of the hospitals and some of the it sounds like field hospitals or influenza hospitals that were set up. I mean, I've only seen the textbooks, but when I walked into this building and saw this, that's exactly what I thought of is,
right.
The Spanish flu pandemic. And really my hope and my prayer and my plea to the people of our county is don't make me use this, don't, please. We can all really spare ourselves the worst of this current pandemic by learning the lessons from past episodes like what you've been studying.
And it is striking to look to do. I was just jotting down some of the numbers that you were suggesting that we're at, depending on how you want to count it, a month and a half into this, and there are 384 cases in Fresno County. In the middle of the flu pandemic in 1918, there were 200 or 300 new cases a day.
Wow.
And it's a much smaller city. And that's why they were filling up places they were scrambling in the middle of the night to outfit new places to be able to put people, and they couldn't keep up for a while. Yeah.
Yeah. And that is something, when you talk about the second wave, when we talk about, how we have to proceed so carefully in this phase where we are thinking about opening things up, and we really need to proceed very cautiously. That has to be really very carefully and broadly accepted as something that we can all get behind, because we could, right. The blunt way to say this is we've been very successful right now with COVID in Fresno, even though we do have cases and obviously we've had some very tragic fatalities. We haven't been hit as hard as other places.
Right.
However, we could still screw this up.
Right.
I mean, it's that simple. I mean, I hate to be blunt about this, but if we're not careful and we stop doing the social distancing and stop using the masks and stop quarantining when we need to, we could really just let this rage out of control And then, that's why my team is here today, is because we cannot stop focusing on this just in case.
Right.
Again, none of us hope that we need to use it, but we just cannot just say, you know what, we're doing just fine. Again, my team's not really focusing on just the case counts. We're really focusing on what you call the doubling time. And the doubling time is really the best measure of how steep that curve is. And you've heard the term flatten the curve. I don't even know if that's something that in the influenza pandemic was a term, but certainly makes sense. And really what we're talking about is doubling time is, we have 384 cases now. When are we going to see double that number? And we want to make that doubling time as long as possible. So it's not like we're not going to see cases, but if we start to see cases just stacking on top of each other, then that is going to very quickly overwhelm the capacity at our medical centers. And then we will need to start doing other more crisis responses, including the acute alternate care site that is behind me. I call it the field hospital. And that's basically the worst case scenario that we are definitely trying to avoid. And we're just not out of the woods yet. We still have to very carefully think about how we're going to proceed so that all of us can safely, re-enter, all of the things in life that we want to be doing, but do it safely and carefully so we're not endangering ourselves and each other. Well, thank you so much, Dr. Keidel. I really appreciate your insights, and I look forward to your continued research and your continued writings about this very fascinating subject.
My pleasure. I'm happy to do it and happy to talk to anyone who wants to reach out. I just want to share the little I know.
We will link to Dr. Keidel's columns as well as the books that he's written about other historical topics. He's such an asset to our community, and I really want to thank him for being here and taking time on short notice to help discuss the history of Fresno.
My pleasure. Thank you.
Sure. I'd like to introduce now really someone who's an expert about the future of Fresno. She's the executive director of growth at Bitwise Industries, Chanel Charest. And Chanel, thank you so much again for joining us on very short notice, but we've been following some of the work that Bitwise Industries has been doing in response to COVID. They're one of our most agile, creative, and really successful companies here in Fresno. They're such an inspiration to so many of us here in town. And so I just wanted to give you a chance to talk about some of the work that your group has been doing with the COVID response.
Sure. Thank you so much for having me. It is, it's been a really crazy time, and we're just trying to respond as best as we can, as quickly as we can, with as much as we have to offer in terms of help and resources and capacity and all those things. And being a tech company, I think that especially with what is considered to be a healthy response to the pandemic, is that technology is actually taking the place of a lot of things that maybe others were doing. And so we're looking at how many different ways we can diversify our tech portfolio in order to serve as many folks as possible. So we have kind of three major initiatives that we're rolling along with. One is in partnership with OrderSlip, which is our online ordering platform for restaurants. And so it's being offered for free right now to any restaurant that wants to utilize it to offer takeout and delivery for their product and for their consumers. And so that's just one way for people to be agile and be able to adjust to the requirements, the health requirements that are out right now. And so you can find that at orderslip.com. We also have Onward, Onward California, and then we recently announced Onward US. We've announced Onward Colorado. So it's going to be a national program, but it started in California first, and that is basically a workforce development service. So folks that have lost their jobs can go onto that platform, and it pretty much is the catch-all to find resources for folks who are in a position where they need to find employment, or they have questions about additional financial resources and things like that. So that's another kind of platform that is fastly growing across the country, but is probably one of our biggest impacts. And then locally, specifically in Fresno County, we have the Take Care program, and that is the program that I oversee. And that's specifically getting food into the hands of folks who need it. So we consider the elderly, immunocompromised, and then those, of course, that are in really tough poverty areas, poverty-stricken areas. So Fresno has quite a large group of people that fall below the poverty line. So when a pandemic like this hits, it causes a pretty big impact in those areas specifically, also in rural communities. So folks that maybe don't have access to all of the same amenities that we do, or the same resources that we do. And so we, as Bitwise, donated $100,000 of philanthropic dollars to get the program started. We partnered with Neighborhood Industries, which is a local nonprofit, to do delivery service, because in recognizing that the way to keep people safe is to keep going with social distancing and be as not out in public as possible. And so we wanted to encourage folks to follow that protocol. And so our service is delivery oriented. We've partnered with, at this point, OK Produce has come alongside us and done an amazing job in contributing fresh produce from the Valley. I mean, we are located in the breadbasket, so it's important to really maximize those resources as well. We've been working with the Central California Food Bank as our main resource of food, and we're actually working with them for a long-term partnership. So there are some technical features and production features that we've kind of developed that really could benefit a lot of food pantries and a lot of food banks in the long term. And so we are offering the Take Care software platform at no cost to any food banks or kind of community organizations that want to start feeding the people around them. If they have access to a food pantry source or something like that, then they can go ahead and use our platform for free. And there's different ways to customize it. So you can do the grocery shopping method, which is what we started with. And now we're moving into food box method, because that's actually safer for everyone involved. And it allows us to really maximize how many people we're able to serve. But at this point, we are funneling everything through nonprofit. And so you are able to donate to the cause of just feeding your local community. We serve Tulare, Madera, and Fresno County. And at this point, we're delivering about 600 boxes a week. And so we've delivered about 180,000 meals in the last 4 weeks. And that number is only growing. And especially as the shelter in place continues, it's becoming a greater need. And so we have the opportunity for folks to contribute monetarily. There's also a volunteer page if you're wanting to put your name on the list for if we need backup in terms of packing food or drivers or things like that. So we're being pretty mindful in not overexposing folks. We have a pretty stable base of operators in order to make sure that we're not creating additional pods of infection, which is super important. But at this stage, we don't see it slowing down in any capacity. And we're constantly looking to see how we can be adaptable and just get more food to folks that need it. So that's where we're at.
That's so fantastic. I mean, that's really, from a health perspective, what we worry about is the groups that you mentioned, the elderly, the people that are immunocompromised, the people that just live very far from resources and don't have the capacity to get out and just fulfill basic needs. And the fact that you are helping in that space, it's very inspiring. I mean, I'm hoping that all of these different collaborations that you've been able to set up will actually outlast this pandemic, because it's so important that we have, all of these different wonderful organizations working together on behalf of the community. So I'm very proud of what you're doing. Thank you. And thank to all your partners. And I know that you run with an army of volunteers. And so thank you to all of your volunteers. I really just wanted to showcase the good work that you're doing, because I really want to really cheer and say this is the kind of innovation that is just so really inspiring and also very important for us to be supporting. So thank you for everything.
Thank you so much.
Yeah, thank you to both of our speakers for really those very, very important and unique conversations. I think that a pandemic like this tests all of us in so many different ways, and just seeing how people have survived it before, and all of the different innovative ways that people are surviving the difficult, challenging times now. again, it's inspiring and it's important because this is how we share good ideas. This is how we share what's working, what's not working, what we could do better. And we just need to dialogue all the time within our community to make sure that we get what in medicine we call it best practices, but really all of the great things that work and all of our success stories through this very difficult time. So thank both of you for taking the time to share about the important work that you're doing. Yeah, I will go ahead and leave some time to ask questions from our media partners for either one of my guest speakers or for the public health department, and we'll try to address as many as we can in the few minutes that we have left.
Hey there, Doctor. This is Colby Vermillick of Politico in Sacramento.
Hi, Colby.
2 questions for you, if you don't mind.
Sure.
Wanted to get your thoughts about the Santa Clara revelations, of course, yesterday and today about the deaths earlier. Just maybe like how is that guiding like the county's thinking right now and what it's doing?
That's really a fascinating set of revelations. Just to give everybody some background, as I understand it, Santa Clara shared some reports from their investigations about people that passed away. And these people passed away in mid to early February, and they were able to get tissue sent to the CDC, and the CDC, working alongside with the Santa Clara team, confirmed that these people had passed away from COVID-19. The reason that that's important is because of the timing. We really didn't suspect that there was community spread or COVID infection, for that matter, early in February in that area. And so having that confirmation really makes us reframe exactly what's been going on and how broad this pandemic might have been, and really changes what we know about the timing and the spread. To be honest, it leads to more questions than answers. And I just reading those few brief case reports just in the press today, my mind was just buzzing with lots of questions that I would love to ask, and hopefully we will get those answers about exactly how these folks presented, where where the transmission of this disease came from. But again, I think it's adding to this overall story that we've been seeing with the antibody testing with the Stanford group, and with some of the serology testing that was happening in Southern California. And really the picture that's being painted is that, the case counts that we're watching every day are most likely just the tip of an iceberg, and the rest of that iceberg is really hidden and needs to be explored with some of these other types of investigations, whether that's serology testing or antibody testing in a broader population, or doing some of this testing on people who passed away, and really just keeping that high index of suspicion if we can't explain exactly why they passed away, and really thinking about, could they have had COVID, even though this was, the first week of February, and this was really not seen as a disease that had arrived to that level in Santa Clara or even in the rest of California at that time. So as you'll recall, this was really seen as a very limited spread at that time. And so those revelations have really made us rethink all of our assumptions about what's been going on. Really, how early did this COVID-19 virus get into the various different communities throughout California, and really every day, just about we hear stories of people who are convinced that they had the virus several weeks ago, even several months ago. And I have to say, I wish I had a way to test them, and I wish I had a way to really give them the answer that they seek, is, whether that was the COVID virus or not. Because as you know, there's a lot of different types of coronaviruses. This is just one of them. And there's a lot of different types of viruses that cause a flu-like illness, including influenza, influenza A, influenza B, even things like rhinovirus and RSV can look very similar depending on what the presentation is. And so there's a lot of different culprits that we have to work through, and COVID-19 is the new one on the block, but not the only one. And so we really have to ask ourselves, whenever somebody had a bronchitis this last winter, how can we be sure? And the only way that I think we will really be sure is to do some of this other kind of innovative investigation, like what the Santa Clara team was able to do alongside with the CDC's help, and really some of the serology testing that we're seeing coming out. We're going to be learning about a lot of different testing techniques, and I think that will get people some of these answers. But again, the lesson here is that the science on this is evolving. It's moving very quickly, and that this is just part of one of the many surprises I think in store as we learn more about the COVID-19. But thank you for asking that, Colby. That's a very important question, and if I learn more, or if the rest of our group learns more, we should definitely discuss this further.
Yeah, that'd be great. Thank you so much for that helpful color. And a second question, if I may. You had been talking about today, but also in past press conferences about contact tracing, of course. So just wanted to learn just if the county is doing any kind of like particular twists, like or innovation to that tied to the county's.
Thank you for asking. So you really picked up on what I think is a huge priority for us, which is to really get effective, efficient, somewhat more automated contact tracing, and make it really as scalable as possible. This is something that the CDC is working on. Many other countries have gotten this locked down with various different technologies, and at the state level, California Department of Public Health is also working on. Right now, they're kind of exploring various different platforms and tools that they could use to help all of us do contact tracing. And really something that my team and I are collaborating on as well. My feeling is that this is really something that all of us need to learn. We just need to learn the concept of contact tracing and just get in the habit of knowing what that is, so all of us can be very responsive. The minute that you hear about COVID in your life, you really think about contact tracing. It has to be like that automatic connection and say, okay, someone that I know has COVID, definitely as a physician and as the public health officer, this is something that we deal with all the time. But it's really something that we would love to have the public really educated about, just so that they understand that we're asking these questions for a reason. When we call you and we ask, where have you been? Who's your employer? What's your household situation? We're not really trying to pry. We really just need to know, for the safety of the public, who else could be affected and who else could be infected right now, so that we can actually stop this outbreak as best as we can. I think that there are some technical innovations that will help us do that. I think that there's some app-based and smartphone-based innovations that will help us do that. I feel like there's just a lot more homework that needs to be done before we can really deploy something on a broad scale. And it may not be just one solution. I think, as with anything else in medicine, I think we have to keep an open mind, allow people to really personalize how they want to be contacted, and really how they want to be approached. But beyond that, I'm very optimistic that we will come up with probably a set of different strategies that will help address this need of how do we do contact tracing. My team is handling it because we have 384 cases, and we've obviously closed a lot of those, and so a lot of those are no longer active. But with the active cases, my team is able to get that contact tracing done. I'm very proud of them. I push them pretty hard, but they perform, and I'm very proud of how well they're doing. I just worry that as we scale up with this epidemic, that as we get more and more cases, which I'm afraid is inevitable, that we will need a broader approach to contact tracing that will involve really broader involvement of the population, whether that's going to be at the level of employers, at the level of the medical providers, at the level of the schools, at the level of all of the different social sectors that we have. Really, anywhere where you have crowds forming, you really need to have someone in charge of doing contact tracing. That's my gut instinct. How to operationalize that and how to answer questions about making that efficient, keeping people's privacy at the foremost of our minds, making sure that it's accurate. making sure that it's actionable. Those are all the really hard questions. Like, as they say, the devil is in the details, but really, contact tracing is not going away. It's something that we all need to be comfortable with. And it's something that is actually not hard to do if we all kind of help lift and help lend a hand. It's actually not that difficult to do. It just over a vast number of people, it ends up being something that we really have to think about how to scale that. And I think that a technical solution is what's going to be coming down the line. You can hear about, or you can read about other countries that have apps on their smartphones, and that lets people know about their close contacts, et cetera. And I haven't seen anything deployed on a large scale here in the US, but obviously all of us are waiting very eagerly to see how other communities and how our state partners really promote doing the contact tracing, because we know that that's going to be a very essential, it's the number one thing in the roadmap to recovery of all the different 6 steps. Testing and contact tracing is the number one thing that we have to have in place before we think about unlocking things.
Do you see any challenges to contact tracing being implemented in Fresno County specifically? Like, are there any circumstances that would maybe create issues at all, or anything?
Yeah, so some of the challenges are really just technical, meaning that some people just don't have access to phones. Some people don't have access to internet. So those are the kinds of challenges that I think we'll need to overcome and really help address. There's other challenges that are just about operationalizing, just because we have really a lot of different databases that different people work with, and those will somehow need to connect at some level in order to do this efficiently. So there's logistical and operational challenges, and then there's what I consider kind of population challenges. So yeah, I think there's a lot of different hurdles that we'll have to kind of overcome. But I'm optimistic that we will come up with something that works really well. Right now we're already, like I said, managing, but looking ahead, that's actually my task and my team's task in the weeks to come, and possibly even the months to come, is to make sure that our contact tracing, that we don't lose sight of that, and that we make sure that we keep prioritizing that, because I think that that's one of the most important things we can do to contain the outbreak.
Great, thank you so much.
Sure, thank you.
Dr.
I know I'm over time. Can we take one more question from someone?
Dr. Vora, this is Tim Sheehan with the Fresno Bee.
Hi, Tim.
This hopefully isn't such a nebulous question, but I wanted to kind of get your sense of, once we do get the contact tracing, once we do achieve the testing levels that you're talking about, once we do start to get to that threshold where we can start bringing things back, what do you expect initially and then down the road that a new normal will look like for us?
Yeah, good question. I think right now we just want to make sure that everyone understands that really we have to have certain markers, I guess prerequisites is a better word, to really feel comfortable. And that's why the testing and the tracing are our priorities right now. Is we want to make sure that those are in place. And then beyond that, as we slowly begin to think about how to open things up, we really want to work with people. I have to say, the industries that are open right now, healthcare, critical infrastructure, the stores, the employers, really all of the things that we are able to do right now, we have achieved great success working with all of them. And we've learned a lot from each other about what the expectations are, how do you keep people safe, how do you screen people. And I think that we're going to be able to extrapolate those lessons from the essential sectors to the non-essential sectors. And I don't even like those terms, obviously, because those already have the flavor of arbitrariness. But wherever you're working, we want you to feel safe. And wherever you're employing people, we want you to have the tools to keep your customers and also to keep your employees as safe as you can. And obviously that applies with all of the other sectors that we're working with and serving. And so I think it's just going to take a dialogue. I think it's going to take just sitting down and crafting, really specific guidance, but also giving people the independence to really create the solutions that make sense for them, because different buildings are set up differently. Different organizations have different numbers of employees. Different organizations have different shift times, and some of them need to be doing some of their employee screening a little bit differently. And so all of that really precludes us from creating blanket guidelines that make sense. And we really want to make something that makes sense, that's actionable and rational. And I think that moving forward, that's another really important set of conversations that we want to have. We hope that leaders in all of these different sectors help us by giving us good guidance and good insights. And we hope that we could actually dialogue with them just to make sure that we're prioritizing the health and safety of everyone in our community, because we feel like that's really our major focus right now, is to make sure that, you know, as we take our foot off the brake and push on the gas pedal, that we move slowly and don't accelerate so fast that we get ourselves into trouble. So the phrase that I like to use is, you know, reopen with grace. So let's reopen gracefully and really, you know, be mindful of all the things that we've learned that we know work, like the physical distancing, the covering your face, the good hand hygiene. You know, all of those have served us so well, and let's keep all of those in place, and then think about how we can reopen gracefully in a way that makes sense and keeps everyone safe. And hopefully we can all come up with a process to do that together. I know that that's nebulous, and I apologize. That's one thing that you wanted me to not be.
It was a nebulous question to start with. You've got your mask on.
Oh yeah, go ahead.
You've got your mask on. You know, we have our masks on when we go outside, those types of things. Is that going to be part of the new normal, short term and long term, would you expect?
I do believe it is. I do believe it is. And you know, again, it's such a simple thing, but like I've said before, every person that we keep out of the hospital is a victory. And if you can just wear a mask when you go to the pharmacy, and if everyone else wears a mask when they go out, and that keeps an elderly person, that keeps a young person, it doesn't even matter what age they are. If we can save our hospitals from being overwhelmed and having to surge, and then filling up a spot like this, then that will be a victory. And if it's just a small thing like minding your space when you're at the grocery store and wearing a mask when you're out, then I think that that's totally worth doing. And I like I said in a prior session, we're probably going to need to keep doing the non-pharmaceutical interventions until we get pharmaceutical interventions that have been proven to work.
Thank you very much. I appreciate it.
You're welcome. I think we'll end there unless anyone has any comments or more questions. Oh, okay. Corin sounds like he wants to make a comment or question. Go ahead, Corin. Okay, no problem. While he's getting set up, Dewan Utek, our Director of Behavioral Health, is on. Sorry to put you on the spot, Dewan, but do you have anything to share or anything to let us know about?
Can you hear me?
Yes.
My apologies. I guess the only thing I would share is that we continue to accommodate homeless individuals in our shelters. We have a good routine down. If any of them are tested, we're housing them in isolated rooms in hotels. And from a behavioral health perspective, we're broadly advertising our warm line, and we would encourage that to continue. We have seen, I think I talked about it last week, that we've seen an increase in calls to our suicide hotline, not necessarily individuals with suicide ideation, but individuals who are stressed out right now. And so we want to make sure that we get people to the right resources. Of course, if they call our suicide prevention hotline, we'll get them to the warm line and get them set up with some services. Much like Dr. Vora mentioned, we're learning a lot through this process. We're discovering ways to health and telephone services, which is awesome. We think a lot of that will live on past this pandemic for individuals for whom a telephone or telehealth service is the preferred method. And so much that we're learning, and we're continuing to persevere through this.
That's so great. Thank you so much for everything that you're doing. Really appreciate your support and your collaboration.
And the one other thing I'll say is we are, I think we talked about it last week maybe, that we're deploying resources to do what we call whole person care, which is the ability for our individuals who are in shelter to have their physical and mental health and substance use disorder needs. They're being screened, and we're providing services on site at the shelter as much as we can. We're using iPads to be able to have medical consults. And that is something that we will continue after the pandemic. We utilized some funds that we had received to start a whole person care approach, and we will continue those efforts afterwards.
That's so great. The telemedicine advances that we've seen just in the last 6 weeks are so great, and I'm so glad that that's working out. Thank you.
Yeah, and you know, I'll also say that we are having the occasional person in our COVID shelters who's getting housed, and we are working really hard to assess those needs and get people in our systems, if you will. And as housing becomes available, we will house people out of this.
Yeah, and that's great. And it's really nice. I mean, we discuss this all the time. You know, what's going to happen if there is that COVID patient in one of these accommodations? And Dewan and her team have planned so well that even if there is a COVID positive patient, they have every mechanism in place to make sure that that person gets all of their needs met, and yet they stay isolated from the rest of that congregate setting, so that we can actually prevent a further cluster from forming. And that's really great. That's very forward thinking, and I think that's really going to protect a very vulnerable population and really help us out. That those plans are already in place, and we're really making sure that that we have all of those resources to make sure that that happens.
Yeah, and the final thing I'll mention is that I know the media has reported on it, that we have seen an increase in domestic violence. And part of our strategy as a collective around homelessness is also we've provided some additional resources for the Marjorie Mason Center. And so we've allowed them to surge their capacity in order to house individuals who have been victims of domestic violence. And so we're really happy that we've been able to respond to that broader need as well.
Thank you.
Hey, Dr. Bornheimer here, just checking in. Hey.
Hi. Sorry, Corin, you're breaking up.
Here, I'm asking about congregated settings.
Sorry, Corin.
It's fine. I'll ask on Friday.
Oh, okay. All right. Well, I think I think we'll end there, and look forward to continuing this conversation on Friday, where we will have a town hall format. We'll have other featured speakers. I really want to thank Chanel and Ethan for really the wonderful work that they're doing, and for really making time to present to our group today. And I want to thank everyone for their wonderful questions. I really appreciate the chance to catch everybody up, and I think we'll end there. So thank you so much.
Thank you.